LA County is dealing with a rise in COVID-19 hospitalizations. As the chief medical officer from LA Care Health Plan tells us, it's the highest now since late February.
Hospitalizations here in Los Angeles County have been increasing over the last several months, increasing now to over 1,000 cases per day, where we had hit a low in the 200s. We've steadily increased now over 1,000 per day.
That's horrible news, of course, and I understand that the deaths have gone up dramatically as well. Just yesterday, we had 18 deaths due to COVID-19, and that's the highest that we've seen in a single day since March.
So the more cases we have, even with these more highly contagious forms of the virus, unfortunately, more and more people are being hospitalized with serious disease and the risk of death.
Was it BA.5? Is that what we're talking about?
That's right. BA.5 is considered a subvariant of the Omicron variant, even more contagious than their predecessors, leading to more infections, even amongst people who are vaccinated and boosted.
So with BA.5, what can you really do at this point to avoid being hospitalized or worse?
Vaccination and boosting for sure, but other basic practical recommendations such as masking in indoor public places, particularly in more crowded places.
Now we're starting to hear more recommendations that you use medical grade masks because there isn't a restricted supply of them anymore. Is that what you recommend?
Yes, absolutely. The key is they're tighter fitting, and they restrict the free flow of air around or under the mask as opposed to through the mask, which is what makes them more effective. We are now recommending these higher performing medical grade, either the N95s or KN95s. They are more widely available now. Test kits are also more widely available now and covered by all forms of insurance. Of course, most people in indoor places are not masking. It is not yet mandated, but we're on the path towards seeing it mandated again.
The trigger for mandatory indoor masking is what? 10 patients per 100,000 that need to be hospitalized? That's what we're looking out for right now?
So we're now at about 8.5 here in Los Angeles County.
Very close.
Yes, we've been trending upwards. And if we hit or surpass 10 per 100,000, we would move into that high community level, which could happen as early as sometime next week. Don't wait for the mandate. It's still strongly recommended. Unfortunately, it's likely where this is headed, so let's go ahead and do that now.
Well, here's a look at the latest stats. The number of patients in LA County hospitals has dropped by 7 people to 1,014, one day after jumping past the 1,000 mark. In the OC, there's 280 people in the hospital. In Riverside County, the number of patients went up by another 20 people to 210.
The number of weekly COVID-19 deaths reported in Los Angeles County has doubled over the last month, the first significant increase in fatalities since the winter surge. Over the last week, the nation's most populous county tallied roughly 100 COVID-19 deaths, the highest total in 3 months. A month ago, the county was reporting about 50 deaths a week. Although the numbers are still a fraction of the peak in the winter, when there were more than 500 COVID-19 deaths a week, they underscore the growing concerns over new super-contagious subvariants that have fueled a new wave of infections. There's a lot of misinformation circulating about COVID-re. County Public Health Director Barbara Ferrer. Unfortunately, this isn't true. For all the observations that Omicron is less likely to cause severe illness than the Delta variant, which was the culprit behind last summer's surge, the coronavirus just this year has already led to 3 times as many deaths as the county typically recorded in an average pre-pandemic flu season. So far in 2022, the deaths of 390 county residents from COVID-19 have been reported, essentially equal to the typical combined toll of the flu, drug overdoses and motor vehicle accidents over an entire calendar year, Ferrer said. About 1,500 people in L County died annually from the flu before the pandemic, 1 person a year from a cold, more than 2,000 a year from accidental drug overdoses and nearly 900 a year from motor vehicle accidents. In California, an average of 37 COVID-19 deaths have been reported per day over the last week, a rate that's remained relatively steady in the last 2 months. The state's cumulative pandemic death toll has now surpassed 92,000, according to data compiled by The Times. That's roughly equivalent to the population of Santa Monica. L County recorded nearly 12,000 COVID-associated deaths in 2020 and almost 14,500 in 2021. Hospitalizations are also on the rise. The number of coronavirus-positive patients in L County hospitals on any given day has doubled in the last month to nearly 1,200 as of Monday, the highest figure since February. Of them, 115 were in the intensive care unit, an increase of 64% in the last month. Statewide, the latest census was 4,227, the highest single-day total since late February. Only about 42% of L County's hospitalized coronavirus-positive patients are admitted specifically for COVID-19 illness, as opposed to incidentally testing positive while being in the hospital for other reasons. But officials have also noted a recent increase in the share of coronavirus-related visits to emergency departments. 2 months ago, 5% of emergency room visits were coronavirus-related, now it's close to 10%. Emergency rooms and urgent care centers are filled with many folks that are looking for care for their COVID-related illness, Ferrer told the County Board of Supervisors on Tuesday.
Yeah, Susie, I mean, it certainly is, and they are alarming numbers, but we feel like we keep hearing these numbers and nothing really is changing. Well, things are changing because the virus is changing, and that's why it's very important that many places like this pharmacy here behind us continue to see many people coming in looking for COVID vaccinations and boosters.
I'm double vaxxed and boosted. Go figure.
And more vaccinated individuals are getting the same result.
It wasn't super bad the first time, but of course, I don't want COVID again.
Which is why 3 months after being infected, Sarah Hansen came to Elements Pharmacy in Studio City to get her first booster.
I always think it's safer to be vaccinated, Better safe than sorry.
And she isn't alone.
Most appointments are for boosters, mostly second boosters, and also a lot of testing appointments because we have a surge going on right now.
Sherry Sherman is the pharmacist here. She says with the new uptick in cases, patients want as much protection as possible.
Just because it's mild one time doesn't mean it'll be mild other times.
But this isn't just the same old story or old COVID.
And unfortunately, with Omicron, it's very, very infectious. It's more infectious than the original COVID.
Infectious disease expert Dr. Kimberly Schreiner says whether it's natural immunity or a vaccine, there appears to be an expiration date.
About 3 to 6 months after you've had natural infection on top of the vaccines, your antibody levels will begin to drop, and that's when you're vulnerable.
Which is why boosters are so important. But as the virus is changing, the vaccine is now too.
Both Moderna and Pfizer are working on an Omicron-specific recipe, if you will. That's the beauty of the mRNA technologies. You can kind of just dial in a different recipe. And they are working on that right now, and the anticipation is that's the vaccine that will be deployed in the fall.
But predicting which variant will be most prevalent in a few months isn't easy. So health experts say the best thing we all can do is stay up to date on shots and be smart, because no one wants to play host to COVID.
And let's just hope that my symptoms stay mild, because right now it really does just feel like a cold.
and we're certainly hoping it stays that way for Gayle King. Now, there is going to be a fourth COVID vaccine possibly on the market here in the United States. The FDA will look into Novavax next week. That is the vaccine that'll be the first one that's not a messenger RNA vaccine. It was made the old-fashioned way. However, health experts don't recommend you wait for it. They say if you're due for a booster, go ahead and get one. Susie?
All right, Joy, thank you so much.
Well, tonight, COVID cases are on the rise again, fueled by a recent Omicron strain. The CDC reports the BA.5 subvariant is the most dominant in the U.S. now, with new cases and hospitalizations forcing some cities to reconsider mask mandates. CBS's Carter Evans has more.
Americans are on the move, and for many, this summer is their first real vacation since the beginning of the pandemic.
It really wasn't a question, we just had to do it.
There are few signs of COVID precautions now, but COVID is on the rise. 19,000 new cases a day reported in California, with Los Angeles moving closer to a high level of transmission. That designation would trigger mask mandates. In New York City, cases are up more than 17% from 2 weeks ago. The Omicron subvariant BA.5 is the fastest spreading so far. It's responsible for more than half of all new cases in the country, and it appears to be 3 to 4 times more resistant to antibodies.
Do not try to game this out. If you are eligible for a vaccine, don't wait.
Dr. Celine Gounder warns even if you were vaccinated early on or contracted COVID, you may not be fully protected.
There are early hints that the BA.5 subvariant of Omicron may be more virulent, so in other words, may cause more severe disease.
Now, booster shots designed to target Omicron could be available this fall. Here in Los Angeles, though, if transmission levels remain high for the next couple of weeks, well, we could see masks again indoors by the end of the month. Jerika?
It seems like it never is going to end. Thank you.